Welcome everybody, Jason here, Jason Rozin here once again with Dr. Kevin Conners to do another webinar about a product that we recently released, something I know that Dr. Kevin you're really excited about, especially definitely lots of vitamin D3 products out there, but when you and I discussed some of the unique features about this particular player, I know you got quite excited, and then adding the enzymes to the mix of it, of course, just to help the absorption, and that's the the D3-XYM. So, Dr. Conners, why don't you maybe just comment a little bit about why you were so excited to bring this guy on?
Well, I'm always excited about D3 because I've treated cancer patients. I mean, you want to prevent cancer, you want to use D3. I mean, that's a key player in stimulating apoptotic receptors on the cell membrane to stimulate apoptosis. So it's an important factor. And the reason why I like this product is it's a fermented product, which always crosses the gut wall better. And you, again, like we talked about in every one of these webinars, anything you add enzymes to, it just works better. So
Yes.
it's a great product. The other thing I really like about this product is the dosage. So at 5,000 IUs of D3, you have, I mean, typically if you're not dealing with a cancer patient, you'd have them just dose at one a day. I have my cancer patients dose 2 or more a day, measuring their D3, making sure that we're not getting too high. But we also want to look at their genetics. If you're doing any genetics, you look at their BDR receptor genes, their vitamin D receptor genes, to see how they do as well. So those are the things that you look at with VD, and make sure that you when you're measuring it, you don't go off of the standards that the lab gives you. Because I think the normal standards, Jason, if I'm correct, are like 30 to 80 or something,
Right.
or within normal range. And I want my cancer patients to be, you know, over 80 and, up to 150. And if you have VDR gene defects, whether you have cancer or not, you want to keep your vitamin D levels much higher than the normal range. So,
How about your traditional? Maybe they don't have the gene defect, but an autoimmune patient or someone struggling with nasty infections.
well, you know that vitamin D3 is not a Th1 nor a Th2 stimulator. It mainly stimulates the T helper cell system. So it's therefore an immune modulator. So it helps balance a hyperimmune system if somebody with autoimmune issues or allergy issues. So that could be really beneficial with that. Also, just some clinical pearls with vitamin D3 if it helps anybody. People with any tachycardia issues, you can literally be a lifesaver for somebody with vitamin D3. So deficiency in D3 is rampant, and you can have a person with a vitamin D3 level measured at 60 and they're still showing clinical deficiency. So I don't think anybody's too high in vitamin D unless we get over 200 on a blood test. But and I've had patients over 200 on a blood test when they're like dosing, if they come to me and they're dosing 20,000 IUs of vitamin D, I think you're getting too high at that point, and
Right. I
we
agree.
decrease their dosage. But otherwise, I want my cancer patients over 100 on their blood test. So um, it's really important.
Yeah, and even for
And
the
this is
docs out there that aren't, working with, these really sick patients, anywhere from autoimmune all the way to nasty chronic disease, it's still something that is just wonderful just to carry on your shelf, even if you're just getting into nutrition. Like we talked about enzymes and HCl as being a good place to really get started. And then I think another great place to get started if you're a total newbie is right here.
Well, people are taking cholesterol lowering drugs, right? probably the number one prescribed drug in America.
Right.
The problem with that is that cholesterol in the bloodstream breaks down into the byproduct. I think it's 125 hydroxycholesterol. That is what makes vitamin D in the skin from the sun rays.
Right.
So if a person is forcing their cholesterol levels down with medication, they end up deficient in vitamin D. They can't make the vitamin D from the sun because people think, oh, I'm out in the sun all the time. I don't need any vitamin D. Well,
Right.
measure their levels. You'll still see that they're very low in vitamin D. And you think, well, why is that? Are we meant to have to take a vitamin capsule all the time? Well, no, it's because the interaction of the medications people are taking affecting the liver, affecting cholesterol production, affecting the ability to make vitamin D in the skin with sunlight. So it's kind of a negative cycle. So if you're just even doing chiropractic and you even have any idea what people's cholesterol levels are, or you know that they're on a Lipitor or something like that, it's good to get them on vitamin D. And the beauty of this product, you could just have them take one a day. Goodness sakes, it lasts them for 4 months,
Right.
and it's a pretty cheap product.
Yeah, it's definitely a very cost-friendly product. And what we've done here is try to make something like we always do that's unique. So we're going to get a lot more into this form of vitamin D3, and then of course the enzyme blend, which most people know anyway. To get anything in and out of the cell requires an enzyme. So that's another thing we wanted to add to this, just to give it that extra boost, because there's a lot of issues out there with traditional D3s and cell absorption. So we've conquered it from two levels: the enzyme, and then this form of D3, which we'll get into next. So, Dr. C, why don't you tell us a little bit more about this fermented D3 that is also vegan, which is another really nice selling point about this product, is most D3s come from 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 sheep's wool. So why don't you take it away here for us?
Well, and that does beget a lot of your patients that are concerned with their products. So number one, if you have a person that wants a vegan product, here's your product for D3. But I think it's also has to do with how it's going to be utilized by the body. So anything in its more natural whole food form, it's going to be utilized better by the body. So for a fermentation process of any nutrient, that was a great selling point for some other products that you used to be involved with, Jason.
Right.
Um, your body can utilize it better, and it has to do with your microbiota. So if your microbiota is going to be able to recognize it and bring it across your cell membranes is with your epithelial cells in your gut wall, you're going to be able to absorb it better. So it has a lot of great selling points to it. So even if you left out the enzymes, it's still going to be a better product as far as absorption of D3. But then you add the enzymes and it's a double win.
Yeah, I completely agree. It just solves a lot of questions that people have with D3, even like an emulsified version. This is in our minds anyway, going to be even more superiorly absorbed. So, yeah, definitely. If you're used to giving your people high amounts of D3, run the blood lab maybe a little bit sooner than you're used to, just to see how quickly you're getting that patient into range, and then keep them on that maintenance dose.
I always tell my patients to put their D by their toothbrush, so they remember to take it every day. So it helps, but it helps my patients. It's just a must thing that they have to be taken every day.
Yeah, I agree. The old medicine cabinet trick is great for enzymes as well. So keep it right there with your enzymes and your D3. Makes it a lot easier to remember to take it every day. So anything else before we close out here that you'd like to mention on this product?
Um, I think we covered everything.
Yeah, well, we hope this is going to be a big blessing for a lot of people's practices and answer a lot of questions or objections you might have with some vitamin D3 that you might be currently using. And as always, if you want to learn more about the products, you can visit our website, email me, And then here are the links to both of our YouTube channels where this and other videos that Dr. Conners and I have done and will be doing. So thank you so much, everybody, and have a great night.
All right, bye-bye.